I am Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with lifelong medications. Here we learn of the approach for a patient who was suffering from chronic kidney disease, and it was reached stage 5, and he was actually diagnosed with IgA nephropathy 16 years back. Now he reached a stage of renal failure and advised to start dialysis and arrange for renal transplant also. And he is suffering from hypertension also for the last 16 years. Actually, his IgA nephropathy itself is diagnosed when we investigated for the reason for the hypertension, and he had undergone a renal biopsy, and only after renal biopsy we can diagnose such a disease like IgA nephropathy. It's an autoimmune disease, and his uric acid also high. It's also he's taking medication for that. He was also diagnosed with benign prostatic hyperplasia for the last 3 years, and now his PSA, that is the prostate specific antigen, is a marker of the prostate cancer, that is also started increasing. And also he is a non-varicose vein patient also. He's noticed varicose vein for the last 40 years, and for the last few years he is having skin itching and darkening and problems also. And he is also having gastric problems. And on the scanning shows that the gallbladder polyp is there and fatty liver is there. And he has the back pain and knee pain also, arthritis problem is there. And also the scanning shows the renal stone. There are chronic renal failure symptoms, signs are there in the scan, and also renal stone is there. And he is having sleep disorder also. That is, especially with all these diseases, the sleep also get deprived because so many problems are there. That is very common with this renal failure patient especially. He is taking 10 tablets a day. There are different types of medicine, 7 different types of medicine. And he is advised to do a AV fistula, that is as a preparation for the dialysis and arrange for the renal transplant also. In spite of diagnosing the disease at an early stage 16 years back and taking all this medicine for the last 16 years, now the renal failure needs a renal transplant. Here I will try to explain how the surgeries could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on the corresponding improvements in the periodic tests. When we come to the details of the patient, this is a 54-year-old male, 171 centimeters height and weight is 83 kg, and body age is 61. Actually, his only calendar age is only 54, but so accelerated aging is there. That is almost 8 years. Accelerated aging is there, and his abdominal circumference is 1 or 2 centimeters, and the fat percentage is 29.4. Now, the disease categories having multiple disease: kidney disease, hypertension, prostate problem, urinary bladder problem, and abdominal problem, lung, liver, and gallbladder polyp is there. So it's multiple problem. It's a category of the disease. When we categorize the patient, the disease also, this category is actually coming under autoimmune disease. That is, IgA nephropathy is the major problem, and that comes under autoimmune disease, and also metabolic syndrome, obesity, hypertension, dyslipidemia, and all is there. So when we come into the symptoms of the patient, his major problem is he is suffering from body pain and gastric problems, and he's no sleep disturbance, difficulty in walking, and also he find it difficult to drive also because of the joint problem and urinary problem, and he needs frequent waking up and urgency for urine, and multiple urinary problems is there. And also, usually this sort of patients, especially with the prostate problems, there will be sexual dysfunction also. Will be there. But for this patient, he's living some sort of a sannyasi life, so it's not important for him. Next, when we come to the medications, he's taking almost 10 tablets, that is 7 type of medicines he's taking every day. And that's mainly for this hypertension. He's taking prazosin and twice a day, Nordosis, that is actually for the kidney problem, and Conco, that is also for the BP, Acromin, that is also for the BP, that is clonidine, and Lobum, that may be for the kidney, and Febutas, that is for the Febuxostat, that is for the uric acid, and that is Atorvastatin 10 milligram he's taking, that is for the dyslipidemia. And when we come to the blood parameters, he's having a chronic pancreatitis also is there, but he's not diabetic. Most of the chronic kidney patients will be diabetic also, but he's not diabetic, but he's having a pancreatitis is there. And his inflammatory parameters like HSCRP, ESR and all is high, and anemic, and all the renal parameters, GFR, creatinine, urea, uric acid is all abnormal, and microalbumin, urinary, you're having renal protein loss is there, and electrolyte imbalance, already potassium level is high because he's in a grade 5 renal failure actually, because GFR is less than 15 and creatinine is 6, and urea is around 49, uric acid, everything is abnormal. And even the urine shows, routine urine examination also there is protein loss, and RBCs also, that is red blood cells is leaking out from the kidney. And his vitamin D is very low, and PSA is high, prostatic cancer indicator is marker is high, and his cardiac markers, troponin, usually these patients can have cardiac problems, but the troponin level is normal. When we come to the scan reports also, he's having echocardiogram shows some pulmonary regurgitation, but that is not that significant actually. And the abdomen shows, this abdominal scan shows renal problems is there, and also renal calculi, that is stone is there, and the bladder shows some obstructive features, that is because of the prostate problem actually. And this gallbladder, there is gallbladder polyp is there, and also the fatty liver is there, and prostatic enlargement. There is multiple problems in the abdominal scan also. It comes to the clinically supported lifestyle correction. In such a patient who is advised for starting for a renal dialysis, that has to be continued for lifelong for such patients, unless we find out, get a kidney for transplant, that it is successful. Till a successful renal transplant is established, he has to undergo renal dialysis actually. For such a patient, what we can do with this clinically supported lifestyle correction, and what was the result also. So when we started with the clinically supported lifestyle correction, and actually in the clinically supported lifestyle correction, what is we are giving is giving optimal nutrition, optimal exercise, that is stimulation for the body, and also minimize toxins. For a kidney patient, and who's in a kidney failure patient, we cannot give optimal nutrition because he cannot tolerate normal so potassium level and also normal level of protein. And actually for the normal person, we are optimizing the body protein level to 50 gram per day, and if a younger patient who need some muscle development, and also we can increase that also. If the kidney function is okay, there is not need for protein restriction, we can take around 50 to 80, 50, 70 or 100 gram of protein, up to, that is depends on the patient age and body building interest they have. But for this patient, we had to minimize the protein level, and to make sure that the quality of the protein also is in a good condition, and to reduce the potassium level, because already the potassium level is high. But luckily he is having no problem for excreting water. So if there is no problem, if the patient can, the kidney can excrete the water, so I usually advise them to take enough water to maintain the renal output, urinary output to around 1500 to 2000. Okay. The water intake is adjusted according to the output, urinary output. And if the patient is using the steam and or the hot climate, especially in Kerala, where I practice, and also the patient is also from the Kerala itself, it is very hot climate. So it is according to the water intake is adjusted accordingly, and also always monitor with the electrolyte values for the renal failure patient. Every week we are checking, and also if needed twice a week the renal function and the electrolyte level is also checked. Then when we come to what was his result actually with the clinically supported lifestyle correction, his major symptom was actually body pain and discomfort. That is reduced to 70% by the 8th day, and it is gone by 15th day. The gastric problem is over by the 8th day itself, because it is on a special diet, no? So he's not taking, actually all these autoimmune disease patients will be intolerant or allergic to many regular food. For him, he was allergic to chili, tomatoes, maize, that is corn, egg, groundnut, lady's finger, chicken. This all comes under normal Kerala diet actually. And oats. He's very highly allergic to oats, milk, barley, mushrooms, or even rice. Kerala diet is one of the common factors, rice also. So it is all depends on the individual, it will be varying. So I am not going into the details. So many items his body is reacting. Actually, it is from the antibody levels we are making a diagnosis of such things, and such things he was asked to avoid, and a special nutritional food is given, and also the other things which is not he's asked to take other things which is not he's not allergic to. And with that the gastric issues is gone, sleep disturbance also reduced, and walking difficulties reduced almost 90%. And driving difficulty, he's able to drive without difficulty by the 8th day itself, actually he's saying. And urinary problem, 50% reduction by the 50th day, and by 15th day, that is after when the 2 weeks visit, he's symptom free actually. Next we come to the how was the medicines how tapering of the medicine levels actually. The Renopres he is taking twice a day. It was reduced to half a day, half the tablets by 30th day, and it was stopped by day 60, and asked him if he is having a stressful situation and the BP high or like that, he can take, otherwise no need, but he was not taking after that. Then this nodosis is a medicine for the kidney, and that is also reduced to half by 15th day, and by 30th day it was 60th day he was only on SOS medication. And this Concor was reduced to gradually reduced to concurrent by bisoprolol. He has this palpitation problem also, so he was asked to it was reduced to half, but if he get a palpitation only, he need to take that by 60th day. Then Arcamin, that is another BP medicine, that was reduced with stopped by 30th day. Then another thing she is taking Globon, and that is stopped by 30th day, and Fibutas, that is for the uric acid, that is stopped by the 15th day, and atorvastatin was reduced to half and initially half and then alternate days, and stopped by the 15th day itself, but we is able to maintain a normal lipid profile actually. When we come to the blood reports, actually he was not diabetic, even though he's having chronic pancreatitis. His amylase and lipase was high, but it was lipase was corrected to normal by 30th day, and amylase also came down to normal by 90th day. Next we come to the atorvastatin, and for the dyslipidemia medicine, it was gradually tapered off by 15th day itself, but the cholesterol level and the lipid level was maintained normal, and even initially his STL level was low, even in spite of medicine, and even the LDL level was high, slightly high, just not too high, but it also got corrected. Even the STL was increased to 48 by after some time. Next, about the inflammatory parameter HSCRP. It was 5.18 when we started, but the 8th day itself it came down to 2.59. Next is ESR. ESR was high 68 and it has come down to 47. So that is actually this patients, because it's a chronic inflammatory disease, ESR may not come down to normal like 15 or 20, and it is very rare to see like that. There will be some that shows that there's some inflammation is going on is there. Hemoglobin level we are able to maintain without, actually he was on medication once in a while he was taking, or before that at the hospital he was given this erythropoietin injection also, but without, after coming here we never give any erythropoietin injection, but his hemoglobin level is maintaining above 10. Actually that is what we are usually aiming for, the about 10 HB level for a chronic renal failure patient of stage 4. Is always around 11, 12 and all it was able to maintain. And for the GFR level, the kidney function is, he is in stage 5 renal failure. We cannot expect to bring it up fast or anything, because for 5th grade that is means his nephrons are gone down to a very low level. But his creatinine level was initially 6 and it has come down to 8th day itself it was 5.78, then creatinine is 5.25, then creatinine came down to, by 60 days it is 4.18, and by 90th day it is below 4, 3.99, and by 180 days it has come down to 3.7. So accordingly by the 90th day his GFR become 16 actually. That is, he came from grade 5 renal failure, he's reached grade 4 renal failure. That's a very positive thing. And if you are able to make it above 20, again he's reaching another level actually. So now by hopefully if he's continuing, if he's correcting his lifestyle and maintaining it, we may be able to bring up to 20, or maybe he can reach above, we are hoping for that, to reach it above 30 GFR actually. And the microalbumin and the other parameters, urea also improved and the uric acid also improved. And the microalbumin also, it was starting with 870, 354 by 30th day, and by 202 by 60th, and by 180 days he's come down to around 180. So it is also gradually, it all depends on the how patient maintaining also. And urinary RBCs and protein also disappeared by the 60th day. And vitamin D was low and it is come down, increased to 32 by 1 month. And the most importantly, the PSA level, actually it was 5.454, and by 30th day the prostate is came down to, prostate cancer marker was also reverted to normal. So that we see with most of the patient, we were early signs of tumor markers is high, like even CEA, CA125 for the ladies and all. If it is moderately high also, it also comes down to normal within a month. Within a month or two, depends on the level and how the patient is managing also. For this patient, even the prostatic symptoms also is, the frequency, urinary symptoms also is come down. Okay, then we come to the scanning result. He has actually, by 180 only we repeated the scan, and by the time his renal parameters, this echogenicity of the kidney and all is continuing. The chronic renal failure signs are there, but his liver, fatty liver and the gallbladder polyp was disappeared, and also he had the signs of bladder obstruction, that also bladder become normal. And prostate, slightly enlarged prostate is grade 1 prostatic enlargement is there, but he was on stage 3 prostatic enlargement. He has come down to stage 1 prostatic enlargement, and the bladder other like the PSA also came down to normal. When we come to the body parameters, his weight was 83 and it has come down to 76 in a month, 30 days, and by 90 days it came down to 71, and by 180 days it came down to 65.8, and the parallel decrease in the BMI also is 28 to 22.5 by 120, And abdominal circumference, his abdominal obesity was there, and 102 to 94 in 30 days, and by 180 days it is came down to 78. So the abdominal obesity is gone actually. He looks very trim by the 180 days. So he was having an accelerated body age of 61. He is only 54, and by 180 days his body age is 44. That is actually we are able to reverse his body age to 44 years actually. That is 10 years younger than what he really is. And 5% from 29.4% to 18.6%. Ideally, for a male, it is always better to between 10% to 15% fat only. Next, when we summarize, what is his benefits actually for coming for a clinically supported lifestyle correction? He's free from symptoms within 2 weeks itself, and he is free of medication also within short time. Then he was supposed to go for an IV fistula and dialysis, starting dialysis. He's not started dialysis, or actually his renal function he is able to improve, and he's able to avoid a renal transplant also. And prostate biopsy, usually when a prostatic PSA is increasing, urologists will advise for a prostate biopsy and prostatectomy and things like that. And also he has arthritis, knee degenerative changes and osteoarthritis is there. This usually it will progress to renal transplant if he is healthy with a healthy kidney. But all these things are unimportant when the renal failure is there. So anyway, he's lifelong. There is no need for any renal transplant now, no prostatectomy or even prostate biopsy. Renal transplant depends on how he manages actually. If he is able to maintain his health and GFR 18, and we would like to bring it up to 21st, and then it is another landmark is going up above 30. By above 30 means he is safe. So if before that if he is not able to, he is not maintaining a healthy lifestyle, or he gets any other serious sickness, like even an infection, if he want to need to take an antibiotic, then definitely he may need a renal dialysis and things he may need. But if he is able to maintain without medicine, any medicine if he is on, the renal function will go down. So maintaining his health and out of medication is very important in this. Then actually he was in grade 5 renal failure. We were able to improve it to grade 4, and we are trying to improve it to grade 3 renal failure. That is the I hope that ultimate we can reach if everything is going fine. If he is able to bring his GFR above 30, that is well done. And I don't think we will be able to reach above 60. That is the grade 2 level. I don't think we will be able to at this stage. And his scan reports actually, he is able to come out of all the liver, gallbladder, bladder problems and prostate problems. So he is able to come out actually. By the scan report also shows the same. And then the body parameters, he was 83 kg to he is able to come down to 65 in 6 months. And body age actually is from 61 to 44. Actually, only thing the kidney age also, kidney function only, the only thing which is not we are able to correct it. Next, what is the message from this case study is, you can diagnose this IgA nephropathy, this autoimmune nephropathy and all is very early stage. Even if you are continuing with the medication, and we are treated only initial phase, only the BP we are trying to correct it. That is the only possible thing also in the modern medicine. What we can give is correct the symptoms. That is, here the symptom is BP and we give medicines for the BP. But actually the problem is with the lifestyle. Even we had to find out what is going wrong with the lifestyle. For this patient, many of the staple diet he is taking routinely, his body is reacting. So find out that and correct it. And also he is obese and he is taking BP medicines. If he started this when we found out at the 16 years back, then definitely it will not be progressed to to this stage. But if the patients he may not be able to, 16 years back, treatment is not there. But here the problem is actually he came here almost 6-7 months back, and that stage he was only reached his renal failure, his GFR level was around 20, but he ignored for another 7 months also. Then the renal function has come down. If he had started that time, at least it was easy to bring up his level 2, level 3 or grade 3 kidney failure. So one thing, if you diagnose with a renal problem, you start immediately lifestyle correction. Definitely you can take the medication and all, but gradually bringing down the medication and correcting all the blood parameters and the body parameters to normal and come out of medication is the most important thing. Only after coming out of medication, his BP is normal, his all the parameters symptomatically is perfectly normal. Only that blood parameters, this renal function is compromised now also. So anyone who's everyone should check the renal function in between, like everyone is checking blood sugar and cholesterol and all. You should check the renal function also. If it is abnormal, to start correcting it, and not with medicine, with the lifestyle. If you are not able to correct by yourself, correct it with the clinically supported lifestyle correction. So if you do like that, at least if you diagnose with an IgA nephropathy and all, with a biopsy and all, try to correct with your lifestyle and find out what is wrong with your lifestyle and correct it. Then you can be able to save your kidney. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.